once again to Stay Alive with Church Alive. And this is your host and president of Church Alive Development Corporation, yes, and the proud pastor of Church Alive Community Church. And once again, we're here to bring you information, resources, and services that will improve the lifestyle of all of you. And we've done that now for over 20 years. And we want to thank you for your prayers and your support for our television broadcast, especially all for our church and the cadre of ministries that we have. And we welcome you to come visit with us. And if you're looking for a church that's reaching out for the community, then this might be the church for you. So we want to thank you so much. We deal with a very serious project or problem or issue. It could be all in one because it makes a major difference in all of our lives. And that is Medicaid. And I will give you my own personal testimony. I came down with prostate cancer about a year ago. And it wasn't for Medicaid getting me through, it would have been almost impossible for me to be sitting here today. Now, we give God all the credit, but certainly we know that the medical field and Medicare and all of these service supports are really a blessing from God. And so we want you to cherish Medicaid in a very special way. You say, well, why? Because the governor wants to cut Medicaid. And we've got to stop that. It can't happen because I would say 70% of the New Yorkers here need Medicaid. And 40%, maybe even more, our children need Medicaid. And so it's important that we take a serious interest when it comes to cutting that vital resource that we need. And to be able to deal with this and give you an education and an understanding, we have with us Jocelyn LeBron, and she is going to give you a presentation at this time that will direct you in how you can be involved, engaged. Now, I'm talking to the Bronxites because out of the 60 some odd districts, the Bronx leads in poor health, poor medical, and also nutrition. And we got to turn that around. And Medicaid has been there to help us make a dent in that terrible statistics. Out of the 62 districts in the state of New York, the Bronx leads in those areas. And so we're going to go at this program and save it, period. And so without any further ado, I bring to you Jocelyn LeBron. Jocelyn LeBron is also, let me give you a title, healthcare advocate. She's a healthcare advocate for the Healthcare Education Project of Local 1199. Welcome, Jocelyn, to Church Alive.
Hi, thank you so much, Reverend Burkett. I'm so grateful that you've given us the time to speak about this very important issue. So my role in the Bronx is basically to educate the community on various healthcare issues. It could be different healthcare diseases like diabetes, heart disease, mental health is another big one that we're focusing on. But every time the new year rolls around in January, the budget is in session. Sometimes there are major threats to our healthcare during the budget season. One of them could be nursing homes, home care workers. But at this time, we're focusing on the threat to Medicaid and the budget. So we have an overall campaign called Medicaid Equity Now that we are working on, and it's statewide, and it's to fully fund Medicaid at 100%. Right now, as it stands, Medicaid is only funded 70 cents on the dollar. Okay. Next slide, please. So Medicaid is a vital resource for our underserved communities in the Bronx, actually throughout the state. 7.7 million New Yorkers are covered by Medicaid, which is a huge, huge, huge statistic. More than 40% of those people are children, and 60% of those are nursing home residents, which equates to seniors. So 60% of our seniors rely on Medicaid to survive. 500,000 healthcare professionals work in facilities that depend on Medicaid, which means that if Medicaid is underfunded, we lose access to more healthcare workers, and the healthcare workers that we do have are overworking to compensate for the lack of resources and the lack of help that they have. Next slide, please. How does this affect the Bronx? Over 987,000 Bronx residents, which is nearly 70%, are covered by Medicaid. And that's a huge number. That's more than half of the boroughs covered by Medicaid. And that directly affects our Black and Brown communities. Okay. Most of them are kids and seniors, as we mentioned before. Next slide, please. So this is what we call an impact statement. It just gives you some numbers on how Medicaid and just the overall hospital system work. This snapshot is of Montefiore Hospital in a recent year study, and it shows you that the inpatient admissions were 167,100 patients, and their overall operating expenses, you can see on the bottom left-hand corner, it's $8.2 billion, right? Medicaid didn't reimburse the hospital at full cost, which means that the hospital itself lost $498.4 million in that 1 year. Okay, so that's a huge deficit that the hospital has to make up for themselves. And most of their patients, as you can see in the bottom right, 87%, are Medicaid recipients. So that's a huge number. Next slide, please. So how does Medicaid shortchange New Yorkers? Medicaid shortchanges nearly 8 million people, the people who are reliant on Medicaid, because it pays 30% less than the actual cost, which means that if a service at a hospital costs $100, Medicaid is only reimbursed $70. $30 is left up to the hospital to either they probably can't make up, that huge deficit, the 30% gap. So our job and our focus is pretty much to close that Medicaid gap. Okay, the funding gap impacts the care received. How? We see short staffing in nursing homes, hospitals, short staffing with home care workers, old technology. We can really use the money to better our technology, to better our services. Healthcare facilities cannot survive financially. Unfortunately, we've seen the recent announcement of the closing of Downstate in Brooklyn, and Medicaid is one of the insurances that the people in Brooklyn rely on the most too. Next to the Bronx, I believe that Brooklyn is also a high recipient of Medicaid. So now we see the direct cause and effect of what can happen to a large hospital system when they're losing millions of dollars because of the low reimbursement rates. Okay, so services are cut or not provided at all. A lot of times, people who are on Medicaid cannot find doctors to accept their insurance because a lot of doctors do not want to accept Medicaid because of the low reimbursement rates. I had a doctor tell me about a month ago that she specifically does not accept Medicaid patients because Medicaid cannot afford to pay her back for what she charges for her services. So that's just one doctor. Imagine how many other doctors in New York feel that way too. Next slide, please. So healthcare inequality, as we see, Medicaid is something that is received and used by people from low-income communities, Black and Brown communities. So that already creates a huge healthcare inequality in our system because it's directly affecting just one group of people, right, who are dependent on this insurance to survive. So the Medicaid funding gap creates that inequality because if hospitals aren't accepting, if they're not receiving the full cost of care, then they aren't able to serve these vulnerable communities. Next slide, please. So the New York Alliance for Healthcare Justice is what we are trying to build. We're trying to build a coalition of hospitals, healthcare workers, faith leaders, elected officials, healthcare advocates like myself, patients, and you, basically to promote a plan to fully fund Medicaid costs. So we want to work together to call on our elected officials to demand that they fully support our cause, which is fully funded Medicaid over the next 4 years. So yes, to support a 4-year plan to fully fund Medicaid at 100% of cost. So with this alliance, we're hoping that we all work together to call on our elected officials to fund it. So what does it mean? Fully funded Medicaid means our healthcare facilities can provide accessible, high quality healthcare that we all deserve, no matter what zip code you live in. And why do I say zip code? Because as we see this from the stats, certain zip codes are using Medicaid more than others. So we want to amplify that message that Access to quality healthcare should not depend on your zip code. Sorry. Okay, so our alliance needs a loud, targeted voice to talk to elected officials. As I mentioned earlier, we have been focusing on this whole campaign, talking with assembly members, state senators, and our direct message is for the governor because she has the ultimate final say in whether or not our plan gets approved or not. The budget is due April 1st. Last year, it went a little bit into April, but hopefully by April 1st, you'll have an answer for us. And what I can tell you all now that's not on this presentation is that our assembly and our Senate are 100% in support of our plan to fully fund Medicaid. So she knows that we have the Senate and the assembly behind us and supportive of us 100%. So now she just has the final say. But they've already rejected her plans to cut any funding for healthcare. So we are pretty confident that they will support us through the end. Okay, so for our New York Healthcare Justice Alliance, and you can see here, this is our overall message. All New Yorkers deserve access to quality, affordable healthcare, no matter their income or zip code, no matter their demographic, no matter where they live, no matter the color of their skin. On the bottom, we have our Medicaid Equity Now logo that I would also be happy to share with anyone. If you send me an email, I believe at the end of this, you'll get my contact information so that you can use our logo in your signatures and your email signatures and just to show support. Okay, so our biggest actions right now, and my colleague actually, she's going to mention a few things, but we really want to get the community to call in their Senate and Assembly members when you can, just to show your support for fully funded Medicaid. Thank you so much for your time. And I'm going to pass it on to Sandra Diaz.
So, my name is Sandra Diaz. I'm a home health aide. Also, just became a certified nurse's aide. So, I've been working on both spectrums of the health field. As a home health aide, I would have to work 2 or 3 jobs just to make somewhat money so I could survive. And it's not fair to the patients that I took care of because some of them needed 12 hours and Medicaid only paid for 4 hours. So I would have to go to 2 or 3 patients' house just to accommodate the patients, which they needed more hours, and accommodate myself, which I had to make money for my family. Um, as a CNA now, we are so understaffed in the hospitals that because Medicaid is not fully funded, we have 3 CNAs per floor. It could be 42 residents on the floor, and it's not. We don't have time to give quality care because we have to just take care and make sure that they have something to eat, make sure they have their medication, and with the whole system depends on safety in the hospitals. This depends on Medicaid. If we're not fully funded, there's a lot of hospitals, like Johnson said, that can get closed. Nursing homes need fully funded Medicaid so we can survive and our residents could get quality care. Home care workers need fully funded Medicaid so our patients could get the amount of hours they need. And it just is like a domino effect. If we don't get fully funded, it's just going to collapse. And like Reverend Brickett said, my father also has prostate cancer, and I'm fighting the insurance to Medicaid so that he can get the treatment that he needs to get in order to survive. I mean, it's a full effect, and hopefully the governor's on board with the 100% funding of Medicaid because our community needs it. It's inhumane for not to have it, for us not to have it. So I really would like the community to be supportive behind us. And this is a fight that it's been ongoing for a lot of years, but this year was just like the worst of the outcomes. And hopefully, God bless you that you came along with your prostate cancer and you got your treatment.
Yeah.
And this is God's work. Like we're missionaries. Thank God I have this platform so I could go to my communities, inform my communities, and also have my communities back us up.
Well, I think that the churches of the Bronx, they are rising to this occasion.
Mm-hmm.
Thanks to your work in mobilizing. Well, tell us a little bit about the political organizing that's important right now, because we're going to have a press conference on the courthouse steps in April, okay? And organizing with Joycelyn and all the workers there to make a difference. But tell us a little bit about the political part of it, because sad to say, a lot of things don't happen unless we can get the politicians. And so that's what we're about to do. And also, Joycelyn, I want to also throw out a question to you. The communities that are going to be negatively affected by this Medicaid gap, I want you to come back and answer that for me. But before we do that, I want to talk about the organizing, because that's something that we have to do right away.
Yes, so I'll just go over, because right now we're in the middle of March. We've been working on this campaign since January. So I'll just go over what our strategies have been since January and how we've been getting our elected officials on our side. So one of those ways is we have support sign-on letters. We've been in person visiting Albany, knocking on their lobby doors and their office doors, asking them to sign on to a letter, asking us to support this cause. And we've honestly been pretty successful with that. I believe most of New York Senate, especially on the Democrat side, have and Assembly have supported our mission here. And if we didn't see them in Albany, we also, some boroughs also conducted in-district lobby visits throughout their boroughs to meet with elected officials face to face. From the very beginning, we had Senator Gustavo Rivera sign on to this bill, and he was pretty much the person who led this bill for us in the Senate. He's the chair of the Health Committee for the Senate, and he's a major supporter of really everything that we do. But he was pretty much spearheading this campaign for us, and he was getting all of the other senators to also support, and he's just been a strong supporter of us from the beginning. That was one tactic, just the in-person visits with them, letting them hear member stories, having them sign onto the letter. That worked out really well for us. The second part of it I want to say is that we had the community call them, and they were making hundreds of phone calls throughout the week, but we specifically assigned for Thursdays to be our call-in days, where we would have the community call their assembly, Senate, and especially the governor's office. And just by having, even if they didn't get anyone to leave a voicemail, but just by having that personal connection on the phone to their office directly was a great tactic for us. And we were successful in doing hundreds of calls per week. The last thing I want to say that we did was throughout the campaign, since January, we collected postcards. Mm-hmm. On the postcards, we went into the community doing different community events. We did food pantries, health fairs, so many things, can name anything, probably did it. I know some of our organizers, like Sandra, went out to malls and barbershops and so many different ways. We got the community to sign on to these postcards showing their support for fully funding Medicaid. And just this past Tuesday, we delivered thousands of postcards to the Senate floor, the Assembly floor, and to the governor's deputy chief of staff. And we collected over 24,000 postcards that we successfully delivered.
Yes.
So
well, I got to get you into the churches.
Well, we did do some churches too. Mm-hmm. We did a lot, actually.
Well, we're gonna get them more involved.
Yes.
I'm gonna work with you. We're gonna get you onto one of our virtual services, and we can extend our virtual service so that you can come on and talk to the people. So we're going to do that. I'm going to talk to the other pastors to be able to extend their service for another 10 minutes so that you can speak to them. So this is important. As pastors, we're responsible for our parishioners, and this is what we must do. Not maybe do it, but this is something that we have to do. And we want to thank you so much, Jocelyn. We have a few more minutes to go, and I wanted to go back to two things to Sandra. How does this cutback affect employment, job situation? Okay. And then we want to go back to the first question you got into it, but I think we need to let all the different communities know how they're going to be negatively affected by the meta gap. Okay, and so, but first, employment. How will it affect the jobs?
So it affected me. I was a home care worker for 14 years, and during that time, I wasn't able to really fully pay my rent. I was backed up, I think, like 6 months, and then I had to go to court and make up the money. And mind you, that I have my elderly father with me. I have my son. I have my brother, my two nephews. So we were literally about to get evicted from our home. So through ERAP and rental assistance, I finally got the rent paid. But I had to decide, which was a bittersweet it was bittersweet decision to leave home care, because home care is my foundation. That's why I become an activist through home care. I moved on to a CNA. So now I make a little bit more money where I can maintain my household. But that's the decisions that I had to make sure that I had enough money to even pay the rent for my house, for my apartment. So I had to move from one field to another, not because I wanted to, it's because I had to, and it was because I didn't make as much money as a home care worker.
Well, we can repeat your story 1,000 times and more, because the same thing is happening. It's systemic, and we've got to do something about this. And but back to that question about the areas, the communities that need to wake up to what's happening.
So I want to address that because we know that Medicaid serves underserved populations, low income housing houses, people of Black and brown backgrounds, right? Medicaid is really what keeps those communities alive. But then we have people who may make a little bit more money, who may have private insurance, say, well, then that has nothing to do with me, right? Yeah. But when you see a hospital like Downstate closing in Brooklyn, then the people who are on private insurance in that local community just lost a hospital because they weren't able to pay their overhead, because they weren't able to financially survive, because they had to compensate for that large Medicaid gap, right? So the Medicaid funding crisis affects everyone, even though it serves mostly, people from lower income households and people of different vulnerable communities. Even if you are outside of that, it can still affect you too if you start to see hospital closures in your neighborhood. So that's the way we like to communicate what we need to communicate to everyone, to make sure that everyone gets involved, no matter how much money you make, no matter what insurance you have, because at the end of the day, if your local hospital can survive, then it affects you too.
All right, we got another real problem that this situation affects, and that is the closure of hospitals.
Right.
Mhm.
Yeah, and I was amazed how many hospitals, some are already closed, some are in the process. And if this continues like this, we're going to really have an emergency problem in healthcare. Do you want to speak on that for a moment?
Yes. Yes, I'm just back to what I was saying. I think the major thing for us is to keep reiterating to our elected officials that these safety net hospitals that are so reliant on Medicaid funding cannot survive if they keep having to make up that 30% that they're losing. They can't financially make it to the next year, make it to the next 5 years to take care of generation after generation if they're making up for the money they lost the year before. So we try to keep reiterating that message and how important that it is for the governor to fund Medicaid at 100%. But also we need to bring in the other communities who are not directly affected by Medicaid to show them that we need our hospitals to work. We need our safety net hospitals to stay in our communities, because if you have a medical crisis, you may have to travel an hour away now to reach a hospital, because that hospital that was so reliant on Medicaid that was closer to you is now closed. So you may have to go outside of your neighborhood just to seek medical care. So it's just, it's a really important issue. We want to make sure that we get everybody from every demographic involved. We know that our assembly and our senate are behind us. They, were able to make some strides in their one house budget. It was I think Tuesday night they submitted their one house budget, but now it's up to the governor. So we have a final push for our community to get involved. We have a big rally to the governor's office next Friday that we're asking all of you to join us in.
Now we're going to put some telephone numbers up on the screen for where they can call. We want to bring out thousands of people on June the 2nd. Now, June the 2nd.
March 22nd.
That's putting it really for probably collapsing by the time. But we would like to have all of you that are watching this program today be with us on April. Already we got people calling in. It's you got excited, boy. Everybody. We want you to look. We're going to give you a telephone number. I'm getting excited too. And then on June, crazy on
March
April the 2nd. April, you know, when you say things like June and August, September, time moves so fast, folks.
Reverend Burkett, our rally is March 22nd, next Friday.
Okay, we got the telephone numbers are going to come up.
Okay,
make those phone calls. March, and then Easter is a time to celebrate the death of Christ, which meant life for all of us.
Right.
All right. And he died that we might live. And by living, it's to get engaged, get involved, and make a difference. We can make a difference, folks. We just have to come out and save ourselves. Well, because when you save Medicaid, you're really saving yourself. At this time, give us a telephone number and give us some few words. We got about 1 minute, Joyceland, to tell us, one more time, what should we do now, right now?
Okay, great. So right now we need everyone to join us at our rally next Friday, March 22nd at 3 p.m. to the governor's office. I believe we're meeting at Foley Square. Not 100% sure, but meet us at the governor's office next Friday, March 22nd, to demand healthcare equity, to demand that she fully fund Medicaid at 100%. My cell phone number is 917-716-5493. If you're in the Bronx, you want to conduct a health fair, you need me to come out to the community to speak about this issue, I will be more than happy to do so. And I'm so happy that we were on this show today. Thank you, Sandra, for joining me. This is amazing. Thank you so much for the opportunity.
Great. Thanks so much, Sandra. Thanks so much, Jocelyn. Keep on doing the work. My prayers are behind you. And the church is here to support you no matter what. We must make a difference. We want to thank everyone for allowing us to bring Church Alive into your homes. We want to let you know that what we say and what we bring to you is things that you must respond to. And we want to close by telling you, we love you with the Lord. Now get out there and save Medicaid. God bless you until next time.